That's perfect.
Hello, my name is Brandy Adams, and today I'll be talking to you about physical therapy. According to the U.S. Department of Labor and the Bureau of Labor Statistics, employment of physical therapists is expected to grow 27% from 2006 to 2016. That is a much faster than the average occupation. A physical therapist provides services to all different ages groups from infants to elderly. A physical therapist helps restore function, relieve pain, improve mobility, and prevent or limit permanent physical disabilities or patients suffering from injuries or diseases. A physical therapist helps a person restore health and promote overall fitness. Most patients include accident victims and individuals with a disabling condition such as lower back pain, arthritis, heart disease, fractures, head injuries, and cerebral palsy. Many physical therapists examine patients' medical histories to test the measure of patients' strength, range of motion, their balance, their coordination, their posture, muscle performance, their respiration, and motor functions. Next, the physical therapist will develop plans describing a treatment strategy and its anticipated outcome. The treatments often include exercises, especially for patients who have been immobilized or lack flexibility, their strength, or an endurance. They encourage patients to use muscles to increase flexibility and range of motion. The more advanced exercise focus on improving strength and balance, coordination, and endurance. The main goal is to help improve how an individual functions at work and at home. Physical therapists use other forms of therapy such as electrical stimulation, hot packs, or cold compress. Ultrasounds to relieve pain and reduce swelling. A physical therapist may use assistive and adaptive devices such as crutches, prosthetics, and wheelchairs. They also show patients how to do exercises at home to speed up the recovery. As a patient's treatment continues, the physical therapist documents the patient's progress and conducts periodic examinations to modify treatments when necessary. Physical therapists often consult with other professionals such as physicians, nurses, educators, occupational therapists, and speech-language pathologists. Some physical therapists treat a wide range of alignments. Others specialize in areas such as pediatrics, orthopedics, sports medicine, neurology, and cardiopulmonary physical therapy. Physical therapy need a master's degree from a accredited physical therapy program and a state license. They also have to require a passing scores on national and state examinations. Physical therapist programs start with basics such as biology, chemistry, physics. They are then introduced into specialized courses such as biochemics, neuroanatomy, and human growth. Besides that, the students receive supervised clinical experience among the undergraduate courses that are useful when one applies to a physical therapist education program. It requires volunteer experience as well in a hospital or a clinic, which is a good way to gain experience. A physical therapist are expected to continue their professional development by participating in continuing education courses and workshops. In fact, a number of states requires continuing education as a condition of maintaining licensure. Although all states require physical therapists to pass a national and state licensure exam before they can practice. A physical therapist needs to graduate from a accredited physical therapist education program. They should also have strong interpersonal skills so they can educate patients about their physical therapy treatment and communicate with the families of the patients. Physical therapists should be very compassionate and possess desire to help their patients. A physician's therapist holds about 173,000 jobs in the U.S. and 6 out of 10 of those physical therapists work in hospitals or in offices of physical therapists. Some work in facilities or self-employed, and some teach or conduct research. The median annual earnings of physical therapists is about $66,000. The middle 50% earn $55,000 to $78,000. The lowest 10% earn less than $46,000, and the highest 10% earn more than $94,000. In the long run, demand for physical therapists should continue to rise and expand the scope of physical therapy practices. And that will be all for today. Thank you very much. I hope y'all enjoyed the speech, and I hope you liked it.